I tell people it's like we held our breath from the time we found out what was going on till the time we got home.
A Kansas man struggling to breathe searched the internet for months. He searched for answers traveling across the country, only to be referred back home to a doctor just a few hours away.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome to a brand new season of All Things Heart. And what better day to kick things off than February 1st, because today is the first day of National Heart Month. So we have a question for you as we get started. How often would you say you visit a doctor on average? Turns out most people would say they go 4 times a year. That's the national average, 4 times a year. But the patient you're about to meet wasn't even close to that. Rick Takeitoff says he hadn't gone to a doctor in more than 50 years. His health deteriorated quickly, though, so he made an appointment, and you'll never guess who in his family finally ultimately convinced him to do it. It wound up saving his life.
Cam, I think she knew something was wrong because she would come up at night and just put her head on my leg and just stay there and stare at me.
Rick Takeitoff is convinced his golden retrievers were the first to notice something wasn't right.
And her tail never quits wagging either.
He hadn't seen a doctor since he was a young boy, but he felt like something was wrong. So, at 62 years old, he made an appointment with a local doctor. The answers did not come easy at first.
We spent a couple months doing testing and working back and forth with them and felt like we weren't getting anywhere, and that's when we asked for a second opinion.
That second opinion almost took him to New York, until a doctor in New York said Rick could get help much closer to his home in Washington, Kansas, and directed him to Dr. Zubair Shah at the University of Kansas Health System.
We were confident in Dr. Shah from day one. I mean, he put it right out there and told us we diagnose, we set a plan, and we get after it. And that's what they did. I've always been drawn to hearts, and then we went through this.
Diagnosed with cardiac amyloidosis, a buildup of abnormal proteins in the tissues of the heart, Rick's condition was dire. His heart had grown twice the size of what it should be, and he needed a transplant as soon as possible.
We have a strong faith in God and knew that however it turned out, it was going to be a blessing, and that's what we held on to.
After just a couple of days on the transplant list, Rick got his new heart. 10 days after his transplant, he was back home in Washington, Kansas.
Girls, you want to come in?
And less than 3 weeks after that, Rick was back at work, praising God and his medical team for allowing him the chance to meet his new grandson that he wasn't sure he'd survive to see.
We never met anyone that did not fully put 150% into their job, whether it was the nurses, the people that came in and cleaned our rooms. I mean, everybody was terrific.
What a whirlwind. Rick joins us in studio today. We are so glad to have you, along with your cardiologist. We have Dr. Zubair Shah here. Dr. Shah is a transplant director of the cardiac amyloid program here at the University of Kansas Health System. Thanks for making time, Dr. Shah. You know, you're super busy.
Thank
Rick,
you for having me.
I want to get right to Rick because this is something that makes all doctors cringe. Well, really, it makes anyone cringe when they hear this, particularly your wife. You didn't see a doctor for decades before this. Was it because you just never felt sick? You never got a cold? Were you feeling awful at times over the years and just muscling through it?
Well, we've been very blessed as far as our health, and just didn't see a need to have a doctor, I guess.
So you didn't even have a family doctor?
We didn't have
nothing.
a family doctor at the time. Nope.
So what was the very first sign something was wrong?
Fatigue, extreme fatigue, and then started getting shortness of breath, and that shortness of breath increased dramatically.
How quickly did this happen?
I would say on the shortness of breath, probably within 30 days, I knew that something was drastically wrong.
And for a guy like you to be fatigued is something.
Yeah.
You're always up and at 'em.
But I was very fatigued for quite a while before that. It was just the shortness of breath that started catching my attention.
So Dr. Shah, is this something that, is cardiac amyloidosis able to be caught earlier with a yearly physical if Rick had been getting yearly physicals?
I mean, unfortunately, no.
Oh,
there is
interesting.
still a lack of awareness about amyloidosis. If we are talking about tertiary centers like KU, where we have high expertise, it will be generally caught early. But most of my patients that are sent from other areas, other centers, it's generally patients like Rick who come very late, and some of the early signs are not generally caught.
So being in Washington, Kansas, three hours away, about a 3-hour drive, that wouldn't have been something that would have been easily caught by any.
Unfortunately, I don't think so.
Is that what makes it difficult to diagnose?
Yes.
What if you're someone here seeing a doctor here at the health system? Is it something that's easy to diagnose if they're seeing?
Yes, aware. It's all how much aware the health care providers are, and amyloid still being slightly thought to be rare. I mean, there's not a lot of emphasis in diagnosing it. And keep in mind, until 2018, there was no treatment available. So again, there was not much interest to diagnose it.
Very recently, 2019?
Yeah, since 2019, we have been having very good options. And even I'm surprised we get a lot of patients like him. Even when it's diagnosed, there's a lot of delay in starting the treatment because I think there's still lack of education awareness how to treat it. In case of Rick, he was told he had amyloidosis, but no treatment was started for, I think, months and months.
That's interesting to hear you talk about how there's a lack of diagnosis, because working here at the health system, I hear the word amyloidosis all the time now, and it's really synonymous with you, Dr. Shah. So we've got the expert here. So it's, thank God, you're within driving distance of Rick. I want to have a picture put up on the screen, because this picture is unbelievable to me. That's Rick's heart next to your fist.
That's right.
Rick, is this the first time you're seeing your heart?
No, my wife had asked for a picture when we were there, and that was...
Oh, your wife asked for it?
Yeah, we got it right away.
Were you like, thanks, Julie? Does it freak you out a little to see it?
No, it's just amazing to me that it was even fitting in there.
How big is a healthy heart next to your fist?
So yeah, it's healthy heart is size of a fist, but his heart easily was 3 times in weight as well as size. And keep in mind what happens in amyloidosis is this protein. In his case, he had a amyloidosis we call TTR, transthyretin amyloidosis, and we all have this transthyretin protein. Its role is to carry vitamin A and thyroxine hormone. We all have this protein, but in some patients with age, this protein becomes unstable and breaks down, and these breakdown products is what build on the heart and make it bulky, make it bigger, and heart is unable to perform its usual function because of this protein buildup.
Is it stiff?
It's very stiff.
Can't beat, so it's just like a hard,
very stiff
chunk, like twice the size of a fist.
You're right.
So, at what % was Rick's heart functioning when you finally saw him?
So his function was around 35%. Generally, the function drops at a very last stage of amyloid, and that's not the problem. The problem is, we have shown this in the past also, the amyloid builds at the cost of the cavity size, and heart is a pump, and we need a pump 150 ml cavity to pump that blood out. But what happens, this amyloid builds inside the heart, and the cavity size is smaller.
Oh, so there's no way it can even move.
That's right. That's right.
Okay.
And then there is no blood. There is no reservoir in the heart to pump anything out. So that's the bigger problem than function dropping, is the cavity size being smaller and the amount of blood body needs, brain, kidneys, that drops significantly.
So, Rick, when you were waiting those months to finally get answers, had your life come to a standstill? Were you still able to get up and walk, or were you bedridden?
I worked up until the day I came in to.
Oh, but
Yeah.
you just felt miserable? You were just working
I still was
exhausted?
working. I tell people I wasn't moving as fast, but I was still working. Yeah.
And this was when you knew you needed a new heart? You
Yeah.
were still up and...
Yeah, oh yeah.
Is that recommended, Dr. Shaw? He says he was still up and doing all his normal things,
I mean,
waiting.
we generally let patients do activity as tolerated, but as I said, Rick was, when I saw him first time, I was surprised, very concerned for him. He came with end-stage heart failure. I still remember he had a lot of swelling in his legs. He was cold, and I immediately knew this is later stages of cardiac amyloidosis.
So you described what happens during amyloidosis with the buildup of the proteins and the heart swelling. When it comes to what causes that, is it age or is it genetics?
Very good. Alexis, it's both.
Okay.
It's both. So, as I said, we are at this point talking, let me start by saying there are 120 types of amyloidosis.
120.
Depending on what protein builds up. But two most common are AL and ATTR. We discussed about AL. It's a cancer of the bone marrow where the excess protein is because of the cancer of the bone marrow. He didn't have that. He had TTR. TTR is built up of this transthyretin protein that we all have. It's a normal physiological protein. We call it a transporter protein because it carries vitamins and hormones from place A to place B. And once it has done its job, it's flushed out by kidneys. This protein is flushed out by kidneys. But to be flushed out, it has to be in its native shape, in its native form. So anything that will cause this protein to break down will lead to entrapment of this protein, because if it breaks down, it's not going to be flushed out by kidneys. And those fragments will break down, will start building on the heart, build on the nerves. So the problem is breaking down of this protein, instability of this protein. And thus far we have identified two reasons why protein breaks down. Genes, hereditary, they are born with unstable protein. We call that HATTR, hereditary transthyretin amyloidosis. Or for unknown reasons, with age, this protein becomes unstable.
Does it make the heart transplant process more complicated?
Absolutely. It's slightly challenging. Heart is thick. We have to choose a very good heart because keep in mind it's a slow process and has been going on some time, and it can take a toll on the lungs. It can increase the lung pressures, what we call pulmonary hypertension. So we have to get the lung pressures down and select a very good heart that can keep up with those lungs.
When it comes to access to this kind of care, Rick, I'd love it if you could walk us through your journey, because you almost went all the way to New York for this before learning that there was an excellent doctor who does this for a living. This is Dr. Shaw's thing, right in your own backyard.
Yep.
Are you amazed that it wasn't more readily known that this doctor was right here?
Well, I'd never heard of the condition until that time, and our primary doctor had been corresponding with a doctor in New York about this because there was some talk of that amyloidosis, and she had referred us to KU because she knew that Dr. Shaw was working on that, and we were overjoyed because when we first heard New York, we didn't know how that was going to work.
Expensive.
Yeah.
Stressful.
And then to find out that we could get this close to somebody that's specializing in it was a blessing, and it was a blessing that we got to see him so soon after we had asked for an appointment. So
your personal story is unique, but the story of patients thinking they were going to have to go far away for some sort of very specific treatment, and then realizing, oh, it's right here, here in Kansas City, is it happens quite a bit where doctors from far away are referring their patients here. So it's really a huge benefit for people who actually live in this area. Dr. Shah, you talked about the genetic component. Does that mean Rick is at risk of having this happen again with his new heart?
Yes, excellent question. So first I want to make it clear that in his case it was age related.
Great,
Yes,
so that
it was
means
but
none of his
still,
family members
None
would
of his
be-
family
okay.
members are at risk, but his protein is still unstable. So there's a risk it will
Could
get
happen.
deposited on the heart, and for that we have put him on the treatment. We are stabilizing that. So besides transplant meds, he's on amyloid treatment also.
What is amyloid treatment?
So we call them stabilizers. There are a couple of medications available right now. They don't let this protein break down so that it's excreted by the kidneys. These meds stabilize the protein. He's right now on one simple pill, very few side effects. And that's what I was saying. Generally speaking, if you start treatment on time, patients generally do good and don't need transplant. But unfortunately, in his case, he came very
50
late.
years too late.
He came late.
Well, maybe 10 years too late. How long was this brewing, do you
So
think?
generally, you know, a good guess is a carpal tunnel syndrome. Same protein builds on the wrist, and generally, this is one of the first clinical sign that patients are having amyloidosis.
A heart problem, as if their wrists are hurting.
Amyloidosis. The important clue is it has to be on both wrists, because generally we always see carpal tunnel, especially in this modern age when we are using phones and computers. We generally see it on the dominant hand, but the clue here is it should be both sides. And Rick, when was your carpal tunnel?
About 15 years ago.
So you
That's when it started.
I had surgery on both arms.
for carpal tunnel.
Yes. And we see this all the time.
Did it fix it?
It took care of it. Yeah, because I was to a point where I was having trouble sleeping at night.
But didn't take care of, obviously, the root cause, which was your heart. So do you have hand doctors often refer their patients to you?
Yes, we now send the samples. We are raising awareness among our orthopedic colleagues, hand surgeons. And the best thing to do is when they do the carpal tunnel release surgeries, we ask them to send those samples for amyloid staining.
Oh, that's super interesting.
So what happens is same protein that's building on the heart builds on the wrist, but wrist is a very tight structure, and a small amount of protein building on the wrist will cause symptoms immediately, while on the heart it will take a lot of time before they become symptomatic, until the cavity gets smaller and smaller to a point where we are not able to get enough blood. You will have symptoms, but wrist symptoms manifest very early because the tight structure.
15 years earlier. That's interesting.
10, 15 is what we generally see.
I'm going to pull up my phone to look for some community questions, because we love when we get questions sent in from our viewers, and you can send them to us in real time on YouTube, Facebook, the X platform, or you can email them to the All Things Heart email. We have all those links on your screen. We want to go to the questions right now. I have a question, though, for you before I get to some of these. They're great. Dr. Shah, if someone watching right now has carpal tunnel in both their wrists and they're not seeing a doctor here for the carpal tunnel, what do they ask their doctor for? When they go in, what is it they ask to be tested?
So, I mean, as I said, the most common clues are bilateral carpal tunnel syndrome. Sometimes patients have lower back pain also because same protein starts to build in the spine, lower spine also. So those are the two important clues. If patients have carpal tunnel and on top of that do have some spinal stenosis also, they should talk to their primary care physician. And I think the first starting test is send them to cardiologist and an echocardiogram, because we'll see more thickness in the heart.
So if you have carpal tunnel in both your wrists, ask for an echocardiogram, ask for a referral.
Yes.
That's really valuable information. Dean Huff wrote in on Facebook. He would like to know if you could describe the relation between amyloidosis and myeloma.
Yes.
And then what's myeloma for our viewers, non-medical
So yeah, as I
viewers?
said, there are different proteins that can build up on the heart or in the body and can cause amyloidosis. We were talking about transthyretin protein, but there are other ways we will have protein buildup, and multiple myeloma being one of them. So what happens is a cancer of the bone marrow, where cells that make our antibody become cancerous. We have too many of those cells, and thus we have too many antibodies. And if those antibodies build up on the heart or nerves, we call that AL, amyloidosis. So myeloma, in short, myeloma can also cause amyloidosis. It's a different type of amyloidosis. It's a cancer, and it happens by building of antibody fragments on the heart or nerves.
James wants to know, what other methods can you use to treat cardiac amyloidosis? You mentioned a pill, and
Yes.
that can avoid, that can help avoid the transplant?
Currently, FDA has approved either a pill, we call it stabilizer, it's tafamidis. It's sold under the trade name tafamidis. It's for people who have age-related cardiac amyloidosis. If patients have hereditary amyloidosis, they are born with abnormal protein, they have nerve involvement, then we use silencers. We have these are shots that we give subcutaneously every 3 months, Amvuttra being most commonly used. And now we have other FDA-approved, Wainua. So we have 2 medications available for patients who have genetic amyloidosis, but for wild type, we generally use a pill like his case.
Rick, I have a question for you. I know that a lot of dog lovers are going to wonder about the dog element. You have 2 beautiful golden retrievers. They were the first to notice something was wrong with you. How did you know they knew something was wrong?
Well, just the fact Cam is the mama dog to the other one. That's her daughter that we have, and then Cam would always come up and lay her head on my leg at night and just stare at me for the longest time. And I was telling Julia, it's almost like, you know, I was not feeling good, and I mentioned to Julie, I wonder if she knows something that we don't know yet. That was in the early part of it, and she it kind of gave me an eerie feeling at first, you know, to wondering what she knows. You know?
She knew something.
Yeah, but she was very persistent. She would just lay her head on my leg and just stare at me for the longest times.
I wish we allowed golden retrievers in the health system. I want to meet Cam, and I think that's beautiful that she knew, and that was what actually weighed heavily on you when you knew something was wrong because your dog noticed.
Yep.
I love that. Don't love it happened to you, but I love that your golden retriever alerted you. Lauren has a question for Dr. Shah. Lauren wants to know, how sick do you have to be to get a heart transplant? Is there a formula, or is it a case-by-case basis?
Very good question, Lauren. So it's case by case. Generally, broadly speaking, it's two types of patients. One, who come very, very sick, their heart function is very low, heart is not able to maintain blood flow to the organs, and we feel like it's irreversible, then we go for heart transplant. Second pathways, these are relatively stable people, but they are slowly declining, and we again feel we are not able to turn their heart function with meds, and go for heart transplant.
Linda has a question for Rick. Linda wants to know if you can talk more about the recovery process post-transplant.
I had a fantastic recovery. They got me up the second day after the transplant.
Who's they? The Dr. Shah came in? Made you get up, walk around?
The ICU. And I took a little trip down the hall very slowly. There was 3 or 4 nurses and a bunch of machinery, and after that first day, then every day after that, I did twice what they had asked me to do, and I felt really good, except for weak. And it was just 10 days after the surgery they allowed me to go home. And when I got home, I would say the first week was just a little rougher than the rest, just because you get away from the element of the hospital, knowing that we're on our own, and if something happens, we're a long ways from them.
Right.
That was a weird feeling, but after that first week, it just kept moving forward then.
Teresa wants to know, what's it like seeing your grandson? How old is your grandson now?
He's, I think he's about 8 months now.
Is he your first grandson?
No, he's our 9th.
You're 9?
Yeah.
Oh, wow.
Yeah.
You're a busy grandpa.
Yeah, yeah, and so he's in Manhattan. When they were trying to not tell us what his name was, I called him Chief, and I still do. So.
Oh, nice. Oh, that's very timely.
Very, very strong Chief fans.
What is his name?
Bannon.
Bannon? I like Chief.
Yeah.
Bannon, Chief.
I still call him Chief.
Are you going to be watching the Super Bowl with Bannon on your lap?
I don't know if we're going to be down there or not, but we might be.
That's sweet. Marie has another question for Rick. You're going to get this a lot. You probably get this from your wife. Marie wants to know, are you going to go to the doctor for yearly checkups now?
I'm kind of committed right now.
Yeah, you better be.
They keep pretty good tabs on me now, so yeah, I look at it a whole lot differently than what I used to.
Right, and that's good. Will you come here for your checkups? How does that
I have been
work?
I have been for the checkups that are needed, and then and then I do some blood work away from the hospital, just so they can keep me monitored.
You know, you could probably weave in a visit with whenever the Chiefs are playing.
Yeah, yeah.
Just come for extra visits during football season. This is just a lovely conversation. You look great. We got to meet your wife, Julie. Dr. Shaw, it must be wonderful to see these success stories, which is why I want to bring you both back in for some final thoughts. As you sit here next to Rick, what would be your message to Rick and then people watching?
Overall, I do want to start by saying, you know, it gives me happiness and joy seeing him doing so well, and seeing and knowing first time how sick he was when I saw him. And I do want to emphasize the transplant part of amyloidosis is a team effort. You know, it's I just advocate for the patient in our transplant meetings we have, but then it's surgeons, it's our nurse practitioners, it's our cardiothoracic ICU. I mean, it needs a lot of work to see results like this. So I do want to thank all of them, especially our surgeons, Dr. Denter, Dr. Zorn. But again, I would say same thing. It gives me a lot of happiness, but also he did his part also, you know. Once he established his care with me, Rick was an excellent patient. I don't know the previous part. It didn't seem like he
was nobody's patient before you.
It didn't seem like he didn't want to see doctors, and I didn't go into that part. But all the appointments he kept, we did telehealth also. I will always see him, and I also remember he would show me his legs on the Zoom. This was COVID time. He will raise his legs, and so it was slightly challenging to follow on him and everything. And we kind of initially 1-2 months tried to see how he will do, and he kept his part very well. So it was easy to advocate for him and get transplant done. And post-transplant again, he has done so well, and part of it is the compliance they have to follow, because post-transplant they have so many office visits, biopsies, right heart caths initially to make sure the graft, the donor heart is doing good, and he has done all of that. So overall, I'm very proud of Rick. It's a privilege taking care of him. He's a gentleman.
Rick, you get an A+ from Dr. Shaw.
I appreciate that.
What would you like to say to Dr. Shaw or people watching who might be in the shoes you were in not long ago, where they just haven't felt like they needed to see a doctor?
I guess I would say that don't ignore the signs if you're having issues. In my case, I don't know how much longer I could have kept going without being checked into. I also want to say that the entire staff at the hospital, it didn't matter whether it was somebody cleaning my room or the nurses or the doctors, they never left the room without asking if they could do something for you. And I so much appreciated that. And I also want to thank the donor family, which is a very important part of this process. I look at each day at how can I live my life so that I honor that gift. And I want people to know about amyloidosis because it's relatively new, and the signs are similar to other things that we've got going on.
Carpal tunnel.
And I just appreciate the ability to be able to communicate it. We were able to have a testimonial at my church for the community after, and I shared with them what amyloidosis was and the signs, and I've been able to mentor to another transplant patient.
Oh, wow.
And so I really much appreciate the opportunity.
You're taking this journey and using it to help people.
Yeah.
With such gratitude.
Yep. I want to help as much as I've been helped.
We love that. Yeah. That's really beautiful. We love hearing and sharing the incredible work that doctors like Dr. Shah do. And something fun we also love doing is sharing with our audience of what life looks like for our doctors outside the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System, let's go behind the mask.
Okay, Dr. Shah, we know that Rick is a proud grandpa of 9. You're a pretty proud dad of this guy. Tell us about your boy.
So yeah, Sammy Shah is 14 now, everybody. So as you know, he's a typical 14-year-old kid, and plays soccer, wrestles also, and is a big Chiefs and Royals fan.
Sports, and more sports.
Sports. And this, one of the pictures we went for Royals game, but the other one you will see, this was the
Chiefs
coldest day. Yes.
Wait, that was this January? You went to that game?
Yes.
You were one of the wild super fans in the.
So he made me. I didn't want to do it,
but you did it.
Yes, he has to. He generally tries to attend most of the games, and we were on the top, and it was
so
crazy.
Cold.
But he's a diehard Chiefs fan.
Right, and so you went and braved the cold. He looks very happy. He doesn't look cold.
Happy. I was shaky. That's why we don't have too many pictures. It was difficult. I only got that one.
Mitten off to click your phone, and then you were done.
Yes.
Well, that's great. Thank you for sharing Sammy with us briefly. I know 14-year-old boys don't want to be on TV very much.
True.
But
I'm not told him that.
And if you're sitting here watching today's program and you're concerned about your own heart health, there's a very easy heart health assessment that you can take. Scan the QR code you see on the bottom right portion of your screen. It will ask you to input your age and then some basic health and exercise questions, along with your blood pressure and your cholesterol. But then it will spit out some results pretty immediately. It will identify if you're low, moderate, or high risk of heart disease. And if you don't know your cholesterol or your blood pressure, that's why you need to see your doctor at least once a year. Rick?
Yes,
Amen
absolutely.
from Rick there. And you might notice that I'm wearing red because I'm getting a jump start. Yes, we love the Chiefs, but tomorrow is National Wear Red Day. It's in honor of Heart Health Month, so we encourage everyone to wear red tomorrow on February 2nd to help raise awareness of all cardiovascular diseases. Again, tomorrow is National Wear Red Day. Thank you so much for being with us today and joining the conversation. Coming up next week on All Things Heart, from med student to patient, back to thoracic surgeon right here at the health system. You've seen this doctor as an expert before on our shows, but this time he's sharing his very personal journey with the same heart condition he now treats.
Coming up Friday on the Morning Medical Update. Courtney Walker was trying to make the good days last, but kidney failure was looming. I'm Jessica Lovell on the next Morning Medical Update, the treasure of living organ donation. Hear what finally convinced a friend to step up. Friday at 8.